board therapy, we are proud to announce that we are now an Aline preferred provider. Aline is an insert that is specifically designed to help your biomechanics of your foot. It's not an orthotic, but it's more of an insert where the arch is not necessarily what we focus on. We focus on getting the heel in proper alignment and allowing the foot to work as it should in normal biomechanics, where when you're stepping, you can supinate and pronate. So when you go to step off, you can pronate in the big toe. And then when you come off of it in your normal gait, you can supinate like your foot's supposed to. It's very rigid in the back, so it won't let your heel move, and it lines your biomechanics of your bones better and helps the arch support here. But it's very flimsy and flexible on the forefoot, so when you step, you're able to step through in a normal pattern, and it doesn't disrupt the normal movement of the foot. The Aline system right here has a laser on it, so we get the patient to stand on here with their heel all the way in the back. The second toe goes in the groove right here, so the laser is going to go from the second toe past her knee up to ASIS for the alignment on both sides. As you can see with this patient here, she tends to have a left hip problem, so she normally tends to stay like this. That's her comfortable position. And if you look at the alignment, she's way off, or looks way off in the knee and the hip because of what's going on in her ankle on both sides. So if we try and line her up the best we can, get her staying like that and bending about 5 to 10 degrees, which is normal stance when you're stepping in your gait, she's about like that. This one lines up a little bit better, but see how far this one is off? So we raise up just a little bit here. We're going to adjust her coming up. So that brings the line, her alignment, better onto her knee and right on her ASIS right here. So this tells me that her calcaneus, or her heel, is in inverted position, and it needs to come out, so it raises up, so we kind of get her back into neutral, which raises up her arch on her foot. And this is a better alignment for both the right and the left. On the left, we can go the same thing. We raise up just a little bit, and if she's staying straight, we can get it right on there. Bend your knee a little bit, and it shows better alignment. So this patient would need a little bit of a lift on the medial part of her insert, and we have these little tabs that are real nice. We stick a tab on the medial part of the heel right here like this, and then we have the patient raise up, and then they stand on this. Let me get it back. There you go. So that one's adjusted for her, and see how that lines her knee up better? Just from having that one little pad on her ankle is going to lock her heel in to neutral and line her hip and her knee up better. And if we do the same thing on the right, we put the same pad on the right medial part of her foot. That's a little pad that clips right on there, and then she raises up. We put her back to neutral, and then she comes back, and it improves the alignment right in here. She stands perfect. You see how it's coming now instead of way off of here? She's actually coming further over onto her left side. So that helps us to line up what she needs to do ankle-wise. And the importance of the ankle and the foot is that's the foundation of what you do when you're standing and walking and running. So these inserts are made for athletes where they don't have very much padding, and it's for people that run and play sports. Well, if they keep this alignment in their ankle and their foot and have normal body mechanics here, it's going to help ankle pain, it's going to help line their knee up, and it's going to help hip, even back and cervical pain that they might be experiencing. So it's a good part of therapy to get your foot aligned so that when we're doing therapy on your ankle, knee, hip, or back, anything that you're coming in for pain for, we can make your foundation like it should be and then build from there. And we've had several patients that have come and they actually had hip and back pain, and when they put the inserts in their shoes and walked around the clinic, their back pain or their knee pain or their hip pain completely went away just by aligning how their foot and ankle sits in the shoe. And again, it's not an orthotic, it's an insert. So we're working on the calcaneus, or the heel of the person's foot, and not worrying about the arch. A lot of people will go to a running store and they say, oh, you're a supinator or you're a pronator, which means you're either moving in or out on your foot, and they're worried about the arch. If you leave the arch alone and correct what's going on the heel, the rest of the biomechanics of the bones of the foot will adjust to themselves as you normally would if you're walking, say, barefoot. So it gives you back to the biomechanics that you should have when you're barefoot walking. So you can wear these. They recommend 2 to 3 hours the first day, then 4 to 6 hours. If you're hurting, you kind of build it up, because you're going to feel different pressures in the arch and maybe on the lateral part or the medial part of the shin, where some of these muscles are getting stretched because it's so used to being collapsed or pulled over just from the poor body mechanics. So you'll get some stretching pain, but after, say, 2 or 3 days, your foot aligns and all the muscles start working better, and the intrinsic muscles of your foot start working as if you're walking barefoot. So that's the whole purpose of having the Aline system work on you. The best thing is to come see a therapist that is trained in alignment for the Aline, and that way we can fit you exactly to what you need with what type of, either you need a post or you don't need a post, or you just need the inserts. There's a lot of different factors that go into it. Rather than just buying it online, you need to have a provider that'll show you what's going on and why your biomechanics are off, and what's going on at the ankle or the hip or the knee, or even back, or even cervical spine problems. And then you can do therapy to correct the problems that are going on. But this is a good way to start your foundation.